Hi, everyone. Welcome to Both Sides of the Story, PBS 12's high school debate tournament. I'm your host, Alan Janae from CBS 4. Thanks for joining us. Tonight, we feature the championship match of our consolation bracket. We're proud to bring you more opportunities this season to see all of our talented students debate. On tonight's show, students from East High School in Denver and Eaglecrest High School in South Denver compete in our consolation bracket championship. So let's meet our participants right now. First up is Talia Hart. She is a senior at East High School. Here's Talia.
My name is Talia Hart, and I'm a senior at East High School. As a little kid, I was always really curious and shy and just always wanting to spend time reading. And I was also super close with my little brother, who now does debate with me, so that's something we get to share with each other. I decided to do debate because I've always been super interested in politics and government, but I never really had a way to share that interest. And my coach and teacher freshman year, Mr. Kaplan, really encouraged me to share my ideas, and he got me into doing debate. My favorite moment in debate was going to the debate national tournament the summer after my sophomore year, because I really got to dive into the details of antitrust law, which is an interesting field of law, but I also got to really bond with my partner and with my coaches.
Talia is so thoughtful. She works incredibly hard. She has stepped up and has been mentoring a bunch of the freshmen and has really helped our program grow because she is so personable and excited about her events.
That's Talia. Next, meet Mason Bachman. He is a junior at Eaglecrest High School. Here's Mason.
I'm Mason Bachman. I'm a junior, so I'm in 11th grade, and I go to Eaglecrest High School. When I was a little kid, I'd say I was definitely pretty shy, actually. I used to be pretty introverted. I used to, never talk to that many people, just read a lot of books. Doing debate has definitely taught me how to be more outgoing just as a person, how to better interact with people, how to have better conversations. But I would also say it's definitely taught me, how to be more assertive and have better conversations when I'm trying to argue for the things that I really care about and believe in.
Mason is a very level-headed debater, and he's definitely a listener first and foremost. He listens so much in the debates to make sure that he knows what his opponents are saying, and because of that, I see him being really successful, because I always tell my students, my best debaters are my best listeners.
That's Mason Bachman. Also joining us is our special panel of experts who will offer their analysis of our debate today. They are Dominic Dezzutti, host of Colorado Decides, the election debate series produced in conjunction with CBS 4. He is joined by Krista Kafer, a columnist with the Denver Post. Krista, hello.
Hello. Hello, it's great to be here.
And it is good to see you. All right, time to set our ground rules. Each side is going to present their case, ask each other questions, and have a chance to offer rebuttals. When it's finished, we'll go to our illustrious panel for their own questions, and we'll find out if they felt offered the best arguments. So let's get started today. Here's our issue up for debate. It is this: should the United States federal government enact the Medicare for All Act of 2019? Going to be a lot of discussion about this ahead, so let's debate it. Let's have our coin flip right now and get underway. And Talia, I'm going to let you make the call on this one. Do you want heads or tails?
Tails.
And tails it is. What would you like for the starting rounds? Would you like to be the proponent or the negative?
I'll be the proponent.
Okay, Talia, as the proponent, the floor is yours to get things started for 3 minutes, so go right ahead.
I affirm that the United States should pass the Medicare for All Act. A recent report by Harvard found that each year, over 68,000 Americans die because they lack health insurance. Stopping these deaths and supporting our citizens requires the passage of the Medicare for All Act. Specifically, there are 3 reasons to pass the act. First, by providing all people with high-quality care, the act would decrease racial discrimination in medicine. As reported by NPR in 2019, there is a massive disparity in race in the medical services that Americans receive. In fact, white Americans have a life expectancy 15 years higher than their counterparts of Americans of color, according to doctors at the City University of New York, and this disparity has been attributed to differences in medical care. And the Century Foundation reports that African American U.S. citizens are 2 times less likely to be insured than their white counterparts under our current system. Stopping inequity and discrimination within the healthcare system and allowing better health outcomes for all Americans necessitates the Medicare for All Act. Dr. Sachs, a specialist in family medicine, reports that the Medicare for All Act will give over 20 million African American and Latino individuals access to high-quality care that they unfortunately lack in the status quo. Thus, the Medicare for All Act can help to close the racial gap in medical care. Second, the Act will help expand access to mental health services. The National Council for Health reports that 25% of Americans need to choose between seeking out mental health and paying for necessities like food and rent. The Medicare for All Act will solve this, as a service included under the Act as medical care is mental health care. That will mean that 82 million people who currently want mental health care but cannot afford it can get the important services they need. And according to the American Addiction Center, the Act would also allow the 105 million people currently suffering from substance abuse who do not have insurance to pay for treatment to seek out that treatment. Third and finally, the Medicare for All Act would help victims of domestic violence. The Los Angeles Times found that over 2/3 of women receive their health insurance from their spouse. And the Commonwealth Foundation finds that domestic violence victims have twice as much trouble finding health insurance and are even more likely to rely on partners for health insurance. This puts the 870,000 domestic violence victims who are currently on an abusive spouse's health care in a challenging double bind: stay with a violent partner or leave and face medical insecurity and no safety net for health issues. As unbelievably devastating as this is to consider, Medicare for All is a solution. Lauren Pruder from the University of Illinois reports that Medicare for All is a better solution to this issue than any other plan because it does not require victims to risk abuse while trying to get on health care. It is simply universally provided. Allowing 870,000 victims of violence to leave their abusive spouses matters. The countless individuals who need access to Medicare and cannot get it make it clear that the Act should be passed.
Talia, you have to wrap it up there. Thank you very much. That's the proponent's side. Now the negative side. Mason, you have 2 minutes for any questions and cross-examination. Go ahead.
You know, spend in into the amount that private insurance companies spend? Would it match?
Could you say that again? Sorry.
So in relation to the amount that private insurance are paying right now, do you have any statistic about how much Medicare programs would be giving to medical community?
Yeah, so right now we're spending $3.4 trillion a year from private insurance companies to go to hospitals. We would be spending $3.2 trillion a year, so it would go down. That might seem like it would be bad for the, greater medical community. It wouldn't, because the medical community spends so much on administrative costs, on figuring out how to deal with insurance, on covering people who can't pay for their insurance. So it would actually help hospitals and, free up money for them.
Okay. So, what is the frequency of people seeking out mental health related health issues in relation to other kinds of appointments?
I don't know exactly. I know that they are able to access it less. Right now, 25% of Americans report that they really want mental health services, but they feel like if they go get mental health help, they'd have to give up food or rent or other necessities. But I don't have a number on who experiences that with other medical issues.
Okay. So we see that minorities, as you stated, have improper access to medical care. Would another way to improve this not be to improve the economy, to give them better access to jobs and employer health insurance?
Yeah, absolutely. The Medicare for All Act would actually do that in a couple ways. The first way is that it would reduce job lock. It would mean that people don't have to fear leaving bad jobs just because their healthcare comes through their job. It would also decrease the amount that is going into Medicare and healthcare in general. It would mean that we're spending only $3.2 trillion, not $3.4 trillion a year, which is an economic boom, and it decreases inflation and interest rates, which is, good for the economy.
All right, Mason, Talia, we're going to have to end the questions right there. But Mason in the negative. The floor is yours for 3 minutes. Go ahead.
Right. I stand in firm negation of the resolve that the United States federal government should enact the Medicare for All Act of 2019 because of the unaffordability of the program and the resulting medical shortages and delays. Within the status quo, paying for the implementation of a Medicare for All healthcare system is completely infeasible. The proposal under discussion, the Medicare for All Bill of 2019, has seen similar proposals during the past that were struck down. The proposal is broadly similar to Senator Sanders' proposed single-payer plan introduced during the 2016 presidential campaign, according to the CRFB, who estimated that Sanders' plan would cost $28 trillion over a 10-year span. The federal government already operates outside of its means, with Brian Beer stating that the federal government has run deficits during every fiscal year for all but 4 years, from 1998 to 2001. This year, 2020, is set to be no different than previous years, if not worse, since the federal government ran a deficit of $3.1 trillion in fiscal year 2020. More than triple the deficit for fiscal year 2019. This year's deficit amounted to 15.2% of GDP, the greatest deficit as a share of the economy since 1945. The United States, in dispensing stimulus checks to keep the economy afloat, has pushed itself to the greatest financial strain since World War II. A Medicare for All program with a $2.6 trillion yearly price tag is not affordable for the US government. Through voting in the affirmative, the US debt crisis is exacerbated, shortening the fuse on a ticking time bomb. The debt crisis is already a significant issue, with the SSA writing that in less than 20 years, the Social Security Trust Fund won't have enough to recover the retirement benefits promised to baby boomers. Through voting in the AF, government spending is vastly increased at a time when it needs to be moderated and reduced. Secondly, a Medicare for All program will create extensive medical shortages and delays. Within the Sanders program, which holds many similarities to the proposed 2019 Medicare for All program, the Heritage Foundation writes that the cuts in the Sanders M4A bill would sharply reduce provider reimbursements for treatments now covered by private insurance, which represent a substantially greater, more than 50% larger, share of national health spending than does Medicare. This would result in less money going to the medical community, which would accompany the disastrous effect that Medicare for All would drive out many doctors and nurses, and compromise the accessibility and quality of medical care for millions of Americans. This will create a shortage of medical professionals, which would diminish the number of treatments available to be provided to patients desperately in need. As a result, according to the Manhattan Institute, single-payer systems deliver consistently lower quality and access to high-cost specialty care or surgical procedures. To see a real-world example of this, one needs only to look at the implementation of similar systems in Europe and North America. In Britain, Forbes finds that nearly 250,000 British patients have been waiting more than 6 months to receive planned medical treatment, and also writes that long waits for care are endemic to government-run single-payer systems like the NHS. In Canada, a survey by the Fraser Institute found that specialist physicians surveyed report a median time of 20.9 weeks between referral and treatment. This is all in contrast to 24-day wait times in the US. Considering the vastly increased medical shortages and delays and the impossibility of funding this program, I strongly encourage a vote in the negation.
Mason Bachman opposing the idea of passing the Medicare for All Act of 2019. And now, Talia Hart, 2 minutes for questions begins right now. Go ahead.
All right, so you tell me that it's going to cost a lot more to enact the Medicare for All Act. Right now, it costs $3.4 trillion every year to pay for healthcare in the United States, and you tell me it would cost $28 trillion over 10 years. That's $2.8 trillion a year. So why are there actually economic harms if the total cost is going down?
What we're seeing is that a lot of this money comes from the private sector. So it's private sector expenditures to private insurance firms, which then negotiate with healthcare providers and drug providers in order to negotiate things like drug prices, hospital bills, copays, things along those lines. But what we see is when we push that bill from private insurance sector to the federal government, we're suddenly going to see increased government spending, and we're going to hike up the national debt, which brings its own share of problems like lost investor confidence and issues relating to the federal debt.
Okay, and so right now, the way that private insurance companies get money is, people and businesses pay them. If people and businesses would pay taxes to fund the Medicare for All Act, why is that necessarily any different?
Well, it all depends on where the taxes are sourced from. Right now, what we're seeing with individual healthcare provision is that companies, for the large part, especially in lower employment sectors, are actually having insurance provided by the employer to the workers at a company, which helps to reduce the brunt that is put onto the consumer. But depending on the tax structure of something like a Medicare for All Act, we could easily see the tax burden fall onto the consumer or other parts that are currently having reduced payments for their health care through their employer.
Okay. And then if we didn't see these like huge economic harms to the federal deficit in Canada and the UK and other countries, why would we see them here?
Well, the examples I provided in the UK and Canada are actually meant to evidence a different point, which is that we see significant medical shortages and delays in federal systems like the NHS.
Okay. All right, we're going to have to wrap up this round of questions. We'll have to wrap up right there. I'm going to have you guys stay off your keyboards too, because I know you're thinking and you're working at all times. Talia, now 2 minutes for a rebuttal. Go right ahead.
All right, so starting on this idea that Medicare for All is too expensive, I have 4 responses. First, Washington Post says that the burden would actually fall off of consumers and go on to more wealthy consumers. So people who make, say, $400,000 a year or more would end up paying a little bit more for insurance, and people who make a lot less would pay less. Again, according to the Center for a Responsible Federal Budget, that actually means that the federal deficit wouldn't have to go up because taxes on the wealthy could pay for this. That means not only that you drop his argument, but that it's a more equitable solution. My second response is that Medicare for All would actually allow the government to save money. As Rainey of the Fiscal Times in 2020 reports that Medicare for All would reduce expenditures on healthcare by 13% through improving regulation of hospitals that saves costs and eliminating uncompensated hospital fees. In total, $700 billion would be saved a year. The third response to this argument about cost is that Medicare for All really wouldn't cost any extra. The Coolidge Foundation reports that now businesses and people spend $3.4 trillion each year on healthcare. Under Medicare for All, that would drop to $2.8 trillion a year. So because there's less costs, we're not going to see these economic harms because things like interest rates and investor confidence, they don't matter where the costs are coming from. If we're paying way more for healthcare, that's bad for everyone. So because of the decreased cost, you can turn the argument. And the fourth response is just that what he's telling you is going to happen here has never happened in Canada or the UK, according to the Canadian National Museum. In fact, there, the federal deficit has been dropping since the adoption of universal healthcare. So there's no reason it happened here. Then he gives you this idea about provider reimbursements. That just isn't true. First, turn the argument on lost hospital money, because I told you hospitals would save money when there's less overhead administrative costs. They'd become 62% less likely to close, and there would only be a 1% decrease in doctors. And then Luthi of the Modern Healthcare Institute finds that Medicare for All would set up grants for hospitals that saves them money. And finally, on wait times, in the UK and in Canada, there was a 15% drop in wait times over 2 months. So that actually means less wait times under the Medicare for All Act.
Talia Hart from East High School, Mason Bachman from Eaglecrest High School on both sides of the story. The big question tonight, should the federal government enact the Medicare for All Act of 2019? Mason, 3 minutes to respond and close. Go ahead.
Okay. I would like to first begin by addressing my own points and talking about why they still hold. Firstly, let's talk about this idea of government expenditures and decreased funding towards the government. What we see is actually that according to the Penn-Wharton budget model, we're actually going to see a 24% decrease in GDP as a result of the implementation of the Medicare for All bill. And what this means is that we are going to negate the benefits. If the plan is deficit finance paid for by government borrowing, the negative effects of larger deficits on labor supply, capital accumulation, and GDP would significantly outweigh the positive effects on the economy that come from a larger and healthier workforce. What we see is that instead of benefiting the people, we actually deal enough damage through damaging the economy via deficit funding that we create this negative scenario where the people are actually suffering worse than they were before. Next, onto my point of decreased hospital employment and medical shortages. So within the Sanders program, which is vastly similar to this one, private insurance currently pays more than public insurance does towards the healthcare system. Systems like Medicare are not providing as much funding towards the medicinal structure as private healthcare systems are. So what we would see is that Medicare either needs to cover more, which would mean increased prices for Medicare, which means increased tax burden on the people, or we have the same status as private insurance, which currently provides a dominant portion of hospital funding and allows many doctors and medicinal staff to keep their jobs, keeps them in employment. And we see that this actually creates a negative effect where there's unemployment. And in terms of medical shortages, as I stated in my case, there is a 20.9 week wait time between referral and receipt of a treatment from a general practitioner in Canada. And there's more than 6 months to receive planned treatment from the National Health Service, in contrast to a 24-day wait time in the US. These wait times mean that people aren't getting the care when they need it, and they're being made to suffer unnecessary suffering. Now, on to my opponent's points of decreasing racial discrimination. We can both agree that decreasing racial discrimination should be one of the greatest priorities in American policy agenda. But what we see is that instead, by providing greater economic opportunities to minorities, we can actually better do this than by implementing a Medicare for All system. Because under a Medicare for All system, we're going to see wait times like in the UK. This means the people that need treatment aren't able to get this treatment. And in terms of expanding mental health access, as I said, these long wait times are endemic to systems that are single-payer healthcare systems. These people aren't able to get the help they need when they need it. And in terms of issues like mental health, that can prove instrumental to creating and solving issues. And finally, into domestic violence. Again, we can both agree, domestic violence, mental health, racism, these are issues that need solving. But what we see is that dismantling the private insurance system does not do this. With this in mind, I strongly encourage a vote in the negative.
Mason Bachman, thank you very much. Talia Hart, 1 minute to close. Go.
So first, extend my responses to his economic arguments. Primarily, we didn't see these harms elsewhere, so we won't see them here. But then costs go down by $1.2 trillion a year. That drop in cost matters. And if we didn't see any GDP drop elsewhere, he can't tell you it'll happen here. Extend my responses to his wait times argument. Hospitals would save money from saving what they have to spend now on overhead costs from private insurance. That turns all his impacts as wait times have gotten 15% shorter, and hospitals have become 62% less likely to close in countries with Medicare for All, according to the Coolidge Foundation. As a general point, remember that the Center for a Responsible American Budget tells you that we could pay for this with taxes on the wealthy. That means it's more equitable, we wouldn't see a federal deficit increase, and it's just a better solution. The main reason to support the act is expanded access, which he really doesn't contest will happen. Remember, that allows 20 million people of color, 80 million people who need mental health help, 105 million people who need help with issues of substance abuse, and 870,000 victims of domestic violence to get help. He doesn't contest that that will allow them to get help and that they don't have the help now. That's a main reason to support the act.
Talia, thank you very much. Mason, thank you very much. A big, weighty topic. Should the federal government enact the Medicare for All Act of 2019? Thanks a lot for that spirited debate. Let's go to our panel of experts right now, get their thoughts on what they saw. Dominic?
Well, I think you've seen here at this great debate that this is not only an important topic that the entire United States is debating, but that it is not so simple. Yet the two of you have done a fantastic job in tackling it. So well done. Great arguments offered, but your job is not done, as we like to say when it comes to the judging panel. Krista, let's start with Talia. What is your question for Talia?
Well, first I have to say, nice job, both of you, and I appreciate the work that you've done to prepare for this debate. So Talia, I've read the reports that Mason brought up about the delays and the care shortages, and I actually got to see it with my own eyes when I was in England, the very poor care a friend of mine got for his cancer care and the endless delays that ultimately cost his life. If a socialized Medicare type scheme was put here in this country, how would you stop the rationing and the delays from happening here as well?
So that's definitely really unfortunate, and it is true that, there are situations in which this is not completely perfect, but I would say there are three things to remember with that. The first is that there are studies that say that there's a 15% drop in wait times that are over 2 months. So people, they might have a shorter wait, but people are less likely to have longer waits under Medicare for All, according to a study from the Coolidge Foundation. It's also really important that not only wealthy people can get access, which is what is happening right now. And so, ensuring that everyone can get this access really matters. And then I also read a study that says 62% fewer hospitals, particularly rural hospitals, will be at risk of closing. So that's another important thing to remember. Right now, there are a lot of hospitals in really rural areas that are really close to closing, and the Medicare for All Act would save those hospitals money and particularly help people with medical issues in rural communities.
Talia, I want to ask you a question about your point in response to the arguments about taxing the wealthy. And we hear that a lot about that being a solution. I think most people think, okay, we'll tax Jeff Bezos and Bill Gates. Those people are wealthy. But the fact of the matter is, wealthy in the United States is probably anybody making over $100,000, which includes a lot of Americans and small business owners. Are you concerned that taxing the wealthy would actually tax a lot of Americans who are already suffering from costs around health care?
So there would be a lot of people taxed. I think there's a couple of important things there as well. The first is that right now we basically say to even people making $20,000 a year, you have to deal with your own health issues. If you have a really expensive issue, deal with it. So it's important that we actually shift those taxes upwards. But then the Washington Post study I read to you, it actually explains that it wouldn't be more expensive for any family making under $400,000 a year. They would pay less in taxes than they do now on insurance. Once you're making over $400,000 a year, you'd be paying a little more, but those are the people with the resources to pay more. And then it would help small businesses because it would allow them not to have to provide their employees with health care, which can be a big burden that disincentivizes people from working at small businesses now.
Mason, it's your turn. Krista, what's your question for Mason?
So Mason, if we look at healthcare in, say, our Rocky Mountain rural areas, many of those folks only have maybe one or two, in very many cases, just one kind of insurance to choose from, and it's usually pretty expensive. So for areas where people cannot access quality insurance because of the cost, some have suggested that a public option would help that. What would you do in those situations?
I think we've seen multiple good ideas in terms of providing alternatives in terms of health insurance for Americans. A particularly interesting one is Pete Buttigieg's idea of single-payer healthcare if you want it, where you can pay into the system, which allows for people to get the help that they potentially need and introduces competition and things like that to the market. But what we see is that funding an entire public health structure is not feasible with the current debt burden put on the US government through the coronavirus. We've seen the greatest debt as a share of GDP since 1945, the Second World War. And what we see, as I explained in my case, is that what we do here is we see an additional $2.8 trillion per year burden put on the federal government that they have to pay for. And the only two alternatives are to either raise taxes or increase the debt.
Mason, my quick question to you is, in your first point, you say it's going to cost too much. Then your second point is that jobs will be lost. If you're spending more because it's costing too much, how is that not translated into actually paying for more jobs?
Well, what we see in the status quo is that there's actually, like my opponent said, there's more money going in from the private sector. The private sector's provider reimbursements make up a dominant share of medical payments in the community, greater than Medicare payments, as I said in my case. So what we see is that the money that is actually going to medical providers is actually going down, and instead, where that money is going is the federal government is having to pay for it, but we're not actually seeing as much be put into the system. And this puts a burden on medical professionals that results in unemployment and the loss of medical professionals in our country, which only exacerbates the issue of medical shortages and delays.
Alan, another great debate. Give us a second, see if we can figure this out.
Boy, if they could solve this one, that'd be awesome. Thanks a lot, Dominic. We're going to give our panel a moment to consider who they felt won this debate. And that'll give me a moment to let you know tonight's debate completes our round of consolation bracket debates. But next week, we're going to have our third place match and our championship matches of our winners bracket. Now, we've covered a lot of great issues important to everybody in Colorado. To catch up on any of our episodes, you can go to PBS12.org. All right, panel, do you have a decision?
Thank you, Alan. I think we could have taken a lot more time on this, but as you know, we have a job to do as judges. Debaters, you both did a fantastic job. Talia, Mason, very well done. A difficult topic. I think the professionals will be lucky to have you, but we need to name a winner. Mason, congratulations. We decided that your argumentation won the day. You won the debate.
Thank you so much.
Thank you very much. Back to you, Alan.
Yeah, congratulations, Mason. Congratulations to Talia as well. Both of you handled a really heavy topic quite well. That is the winner of our Consolation Bracket Championship. You both gave our viewers really a wonderful debate, and you both ought to be very proud. That's all we have time for our program tonight. I want to thank our excellent students for accepting our challenge and for participating in our debate. I also want to thank our esteemed panel for sharing their thoughts, and we want to thank you for tuning in. It is the support of viewers like you and our sponsors that helps to make this show a reality. You can catch up on past episodes of this program at pbs12.org. You can catch me on CBS4 for all the latest news and information impacting Colorado. For everyone here at PBS 12, I'm Alan Janay. Thanks for watching, and that is Both Sides of the Story.